It may have sustained a kick injury, resulting in severe bone trauma or fracture, or it may have had a collision either with another horse or with a solid object in the field, resulting in either fracture, so for example, a fracture of the supraglenoid tubercle of the scapula, as we see in the upper right image, or peripheral nerve dysfunction. You also need to inspect the field for the potential presence of nettles. Nettle stings can result in a non-weight-bearing unilateral lameness and ataxia. The clinical signs are very alarming to the owner. The good news, however, is that the clinical signs usually resolve within 4 to 6 hours, and treatment is generally unnecessary. I cannot stress sufficiently that even without a diagnosis, analgesia is important, both from the welfare perspective of the horse and to reduce the risks of the development of weight-bearing laminitis in the contralateral limb. And this seems to be particularly important in hind limbs. So the horse on the left has sustained a fracture of the medial intercondylar eminence of the tibia, and also a relatively severe injury of the middle patellar ligament. It's non-weight-bearing lame and is overloading the contralateral right hind limb. The horse in the middle, with the huge swelling in the stifle region, has a rupture of the middle patellar ligament. This in itself has a poor prognosis. The horse on the far right, this is what was the non-lame limb. This was a young thoroughbred racehorse who had sustained a fracture of the patella in the contralateral limb, but at the time of presentation, 2 days later, was treading, constantly shifting weight between the original lame limb and the non-lame limb. And this was associated with rotation of the distal phalanx, associated with laminitis in the right hind limb as a consequence of overloading the initially non-lame limb. Watch this horse carefully, or this hock carefully on the left. As the horse came to start to load the limb, we could see that the superficial digital flexor tendon moved from the point of the hock laterally in a very rapid movement. So there is subluxation of the superficial digital flexor tendon, and then it returns to its normal position. So in the top left photograph, we can see a frozen image of the displaced superficial digital flexor tendon. 1 week later, there was severe swelling in the general hock region, making it more difficult to identify the position of the superficial digital flexor tendon. In this horse, the diagnosis was relatively straightforward, and the horse was relatively calm. This is not always the case, however. Some horses with an unstable superficial digital flexor tendon become very severely distressed. They may kick repeatedly, they may be difficult to restrain and potentially dangerous. And therefore, in order to do a proper clinical evaluation, we may need to sedate the horse, and sedate the horse quite heavily with, for example, ditomidine and butorphanol. Advise the handler that they should wear gloves if the horse is being very difficult before we've sedated the horse. And it may be advisable for both the handler and the veterinary surgeon to wear a helmet.